repeating a medical fallacy over and over, louder and louder, doesn't all of a sudden make it true. What you've already heard today and will continue to hear is this is life-saving, it's medically necessary, it's evidence-based, it's widely accepted in medical and mental health arenas as safe and effective, and it absolutely is not. So as a psychiatrist, I work with patients every single day. I prioritize seeing them, doing a primary assessment. I look at the biopsychosocial model. I talk about family issues and developmental challenges. Are they going through things? Are there things in their past or their present or traumas that they've been through that have influenced things? Diagnostically, I'm ruling out things that may be contributing to symptoms, whether it's depression, it's anxiety, it's distress related to gender or otherwise. We talk about all of those things. Then I talk with the patient about risk versus benefit. Realize this is a very exceptionalized approach to treatment that all of a sudden we ignore everything else. There's diagnostic overshadowing. Don't look at anxiety, don't look at depression, focus only on distress related to gender, and then immediately funnel these patients into an extremely harmful medicalized pathway. That's not medicine. In no other area of medicine do we permanently alter healthy bodies to better align with a person's current, often underdeveloped, especially when they're kids, sense of self. Our prefrontal cortices, that front part of your brain, isn't even fully developed until your mid-20s, sometimes 25, 26, 27 years old. So to think that a child can make a decision whether or not they should go through unhindered puberty, that doesn't seem like a medical decision or conversation I should be having with anyone, let alone a child. My job is not to affirm, quote unquote, in that moment what the child thinks that they need or vulnerable young adult thinks they need. My job is to sometimes hold reality when reality is really difficult and really painful. And we have to walk through that and walk through it slowly. We don't rush to medicine. I think that's part of what has really driven this affirming model, is that we have let go of evidence. I rely as a clinical psychiatrist on evidence-based data and guidelines. My own professional association, the American Psychiatric Association, published a book, Gender-affirming Psychiatric Care, in 2023. I, with several of my colleagues who are here today, we wrote a letter and said, how can you do this? This book says that puberty blockers are fully reversible and cross-sex hormones, they're generally safe. Let us provide harmful hormones at doses we've never prescribed before in children and young adults. It leads them down a path to surgeries, and that's not medicine. It's not acceptable. And we've heard from so many today that have gone through horrible traumas because of what medicine is doing.